African Society of Human Genetics about genetics of spinal muscular atrophy in the Malian population. As outlined, we will go through the background in which we will have a little detail on spinal muscular atrophy, then the objectives of this work follows. Spinal muscular atrophy is an autosomal recessive disorder characterized by the degeneration of the motor neuron in the spinal cord. It's due to the mutation of the SMN1 gene. The homozygous deletion of the SMN1 gene accounts for 98% of cases. It is the most common cause of autosomal recessive inherited mortality. Its frequency is lower in Africans compared to other populations, with an asymptomatic carrier frequency of 1 per 30 to 1 per 50 in European population and 1 per 209 in Mali. The clinical features include symmetrical progressive muscle atrophy and weakness, predominantly proximal, absent reflexes, more accentuated in the lower limbs, tongue fasciculation, hand tremor at rest, lower limbs, and spinal deformities. There are 5 subtypes from 0 to 4 classified according to the age of onset and the maximum motor function affected. There is not a lot of data on spinal muscular atrophy in Africa, precisely in sub-Saharan Africa. We report here genetically confirmed cases of spinal muscular atrophy in the Malian population. Our objectives are to clinically characterize families with spinal muscular atrophy phenotype and identify the genetic defect. Our study, approved by the Ethics Committee of Faculty of Medicine and Dentistry of Bamako, written consent obtained from the participants before their enrollment after a long explanation of the study course. Patients carefully evaluated by neurologists and other practitioners such as pediatricians, geneticists, and other specialists if needed. Socio-demographic data and clinical features were collected and mentioned in medical record. Blood tests including creatine kinase were performed to exclude other causes. DNA was extracted from the peripheral blood by using standard procedures. The quantitative PCR method was performed for dosage of SMN1 and SMN2 gene, which analyzes and examines exon 7 of each SMN1 and SMN2 gene, as well as dosage control gene. As a result, we had 5 families totaling 8 patients with spinal muscular atrophy features and consanguineous marriage in 3 families. Genetics analyses in 3 index patients show with homozygous deletion of SMN1 in all. 2 and 3 copies of SMN2 has been found in patients with type 2 SMA and more than 4 copies in those with type 3 SMA. The observation 1 concerned 24-year twin brother from consanguineous marriage, pointing out the recessive inheritance pattern. There was seen for weakness in forelimbs started at 12 years old with fatigue when walking and difficulty climbing stairs. Clinical examination found more proximal weakness in forelimbs, absent reflexes, and no sensory loss. As shown by this picture, we can note a uppers and lowers amyotrophy, also tendon retraction in lower limbs. Genetic testing identified the homozygous deletion of the SMN1 gene with more than 4 copies of SMN2 gene, evoking SMA type 3. The patient went under physiotherapy with slow worsening evolution. Here in observation 2, we are 4 and 2 years old boys, referred for suspicion of muscular disease. Pregnancy and delivery were normal. There is no consanguinity, but both parents are of the same ethnic group. Symptoms started at 6 months with hypotonia and later with difficulties sitting with falls. He could not switch from lying to sitting himself. The pedigree showing 2 affected males and 1 suspected female from a non-consanguineous marriage with an affected parent, assuming a recessive inheritance pattern of the condition. Clinical examination found a normal cognition, axial hypotonia, scoliosis when they are sitting, generalized amyotrophy predominant in lower limbs, weakness with fasciculation, and absent reflexes. Genetics testing identified homozygous deletion of the SMN1 gene with 3 copies of SMN2 gene. The patient index died at 10 years old due to pulmonary infection. Our last observation concerned 3-year-old girl from consanguineous marriage. She was seen for walking difficulty, started at age of 4 months with hypotonia. She could not hold the head. This pedigree showing the affected patient from an affected parent in consanguineous marriage, pointing out a recessive inheritance pattern. Clinical examination found a normal cognition, generalized hypotonia, accentuated dorsal kyphosis and scoliosis, absent reflexes. And then genetic testing identified homozygous deletion of the SMN1 gene with 2 copies of the SMN2 gene. This is the first such study reporting that high number of symptomatic cases of spinal muscular atrophy in Mali. Despite the low carrier frequency, our study shows that this disorder is not uncommon in Mali. Through the high frequency of type 1 described elsewhere, no case has been found in our study. This may be due, in one hand, to the low size of our cohort, and in the other hand, the delay of diagnosis. Patients die before being seen by a doctor. In conclusion, extensive genetic testing of putative cases may uncover many more cases, which could advocate for treatment availability in our country. Future genotypes-phenotype studies may identify other genetic modifiers. We cannot finish without thanking our partners, our participating families, and all the research team of Mali, especially thanks to Dr. Landouri.